And thank all of you for dialing in to Volume 3 of HCCA Ditch Diggers Dialogue. In these difficult times, HCCA is continually seeking ways to provide relevant information and value to our members on a variety of topics. First, let me give a special thanks to Ashley Hudson, who is the organizer and director of any of the events that take place at HCCA, and in particular, our current flow of Zoom presentations for our membership. Today, we're going to talk about the Virginia Department of Labor and Industry Regulations. In our continuing series of dialogues next week, as a reminder, on August 20th, we're going to have Commissioner Stephen Britch at 10 a.m. on Thursday, discussing the effect of COVID on VDOT's current and future budgets. Now let's move on to today's topic. The Virginia Safety and Health Coalition Board has approved an emergency temporary standard in infectious disease prevention for COVID-19. A number of business associations and coalitions, including the Virginia Coalition for a Strong Economy, of which HCCA is an active member, attempted to moderate the requirements, but we were largely unsuccessful. The regulations are now active, and HCCA members and the business community as a whole have a very short window Excuse me, my computer blipped on me 1 second. The business community as a whole has a very short window to develop a plan of action and put it in place. Susan Salen is an attorney with the firm Rees, Broome, who serves as HCCA's general counsel. She has been a valuable resource to HCCA members on a broad range of issues. Susan has been practicing law since 1987 with a focus on employment law. She assists in the preparation of employment manuals and policies, business ethics policies, proprietary rights, and non-compete agreements, documenting performance issues, drafting and implementing performance improvement plans, and when necessary, assisting with employment terminations. When needed, she defends the rights of clients against unemployment claims, wage claims, and discrimination claims before regulatory agencies, such as the EEOC, Local Human Rights Commission, in state and federal courts. Susan has also provided HCCA members with written analysis of a variety of regulations due to COVID-19 in the areas of employment compliance and the first Coronavirus Act and employee rights and expanded family medical leave. Susan will present for 30 to 45 minutes and then take questions. Please make sure your microphones are muted during the presentation to avoid background noise. And at the conclusion of the presentation, she will take questions verbally. If you choose, you may enter questions on the chat box, and Ashley Hudson will ask you those questions at the conclusion of the presentation. The PowerPoint deck used in this presentation will be available for members of the HCCA following presentation. Susan, the floor is yours.
Okay, thanks. We got a lot to cover today. The regulation, if you've taken the time to download it and print it from the internet, is quite long. It's pretty dense, but it's not too bad once you spend some time with it. And it's my hope today to go through really what are the 9 components to comply with the regulations. And I also have a template compliance plan. It's still in the works, but I can provide it to you in the form that it is after this. And if it makes sense, we can kind of spin through that template and what it looks like if we have time during the presentation. So I'm going to go ahead and get started. That's me. That's my contact information. If any of you are clients of Rees, Broome and you've had to work with me, I apologize, but everybody knows you can reach me on my direct dial, cell phone, or email. So I try to be available because in my area, people need to respond quickly. So this standard was effective as of the date of the publication. So what they did is DOLI sent out, multiple drafts. This had people comment on it, and I guess assumed that everybody was paying attention, and so that we'd all be able to comply whenever this was published on July 27th. I do have a typo here. I apologize for that, but you have to classify and assess risk levels of your positions in your company. That's the first step. We have to have hand washing stations, hand sanitizers. We have to provide COVID-19 training within 30 days of the effective date. If you have 11 medium risk employees, I think that most construction is going to be medium risk. That's how the DOLI has classified it. And if you're in this medium risk category and you have 11 or more employees, you have to come up with an infectious disease preparedness response plan. I'm still in the process of developing that. There is VOSH agency prepared COVID information that's available to all. You have to provide that to all employees. It's on their website. I've given some links for you. Also, I think that you can give employees your plan. You're required to give them the plan, and I think by giving them the plan and attaching the VOSH agency prepared information, you'll be in compliance there. There are HVA standards, probably not as important with this group, and honestly, that's one of the areas that causes me the most concern, because if I've got a leased building, how do I ensure that my landlord's doing everything that it's supposed to do so that I can comply? Because I assure you that nobody has COVID-19 HVAC standard provisions in their leases. It just doesn't exist. You must notify positive tests to the Virginia Department of Health, and in certain circumstances, you have to notify VOSH. The standard expires in 6 months, less extended. So this applies to everyone, every employer, every employee, and every place of employment in the Commonwealth of Virginia within the jurisdiction of VOSH. So we're not getting out because I have a small company. Because as you can see, employer means any person engaged in business who has employees. So except for the United States and probably other states, any private employer is covered here. And an employee is anybody who's employed in a business. So the standards in addition to and not in the place of existing rules and regulations. So PPE required for your industry, including respiratory protective equipment if required, sanitation, chemical compliance, labels, instructions, logged, all those cleaning supplies and hand sanitizers have labels and warnings, and we need to train our employees on that, particularly employees that are working out in the sun with hand sanitizer that's flammable. Think about it. You wipe your hands off with hand sanitizer and then you go work with a torch. Probably not a good idea. So we have to remind employees that, we have to keep our hands clean, but at the same time, not have to do things that cause us to catch on fire. Conflicts between the ETS and other rules are resolved with the more stringent standards governing. So if something isn't as vigorous as the ETS, that standard will apply. So here are the mandatory requirements. And you'll see in the template plan that I've developed, these are really the steps we have to follow. So step number 1 is going to be assessing your workplace hazards and job tasks for COVID-19 exposure. So we're going to look at each job, and then we're going to assess what that risk exposure is. It's very high, higher, medium, and lower. And then you control the risk of exposure from other employees by developing self-monitoring for symptoms or self-monitoring for symptoms due to exposure. So generally, we want employees to be cognizant and monitoring how they feel, and then particularly after they've been exposed. And then we're going to develop and implement procedures for reporting COVID-19 symptoms. So under the regulations, an employee is suspected to be infected once they have symptoms. And as you know, some symptoms can mirror flu or some other thing, asthma, but they're suspected to be COVID-19 positive if they have a symptom on the list, and you have to treat them as such. And you have to prohibit your employees or other persons that are suspected from being infected from coming to your work site until they're cleared to return. Step 5, provide flexible leave policies to the extent feasible in accordance with applicable law, the Families First Coronavirus Response Act. We all know about that. That's paid sick leave. for 14 days under the qualifying reasons 1 through 5, or expanded FMLA, which is childcare, and only childcare, if somebody cannot work because of childcare issues. Mandated state leave laws, those of you in Virginia don't have to worry about that. But if you've got workforce in Maryland, of course, you're providing earned sick leave, and you have to notify employees of that. We have ADA, Americans with Disability Act accommodations that come into play here, and of course, Family Medical Leave Act for serious health conditions. COVID, in its mild form, wouldn't be a serious health condition. But COVID, once you get ill to the point where you're hospitalized, is probably going to qualify for Family Medical Leave Act if you're covered by that. You have to also discuss 6 with your subcontractors and other entities your policies regarding handling of workers that are infected or have been exposed to COVID-19, who have interaction with your employees, and you need to find out from them what are their policies, see if those policies align with your policies, and if they do not, you got to tell the contractor you have to follow our policies. You have to establish a system to receive reports of positive COVID-19 tests of employees or others present at the workplace within the previous 14 days prior to a positive test. What does that mean? So if you have an employee who's tested positive for COVID-19, you have to designate somebody who can receive that positive test report of that positive. You also have to have the person who's designated to receive positive test results from subcontractors or others, because you have to notify employees that may have been exposed within 24 hours of discovery of the possible exposure, again, not disclosing the name of the employee, and you have to notify other employees in the entire work site that there's a possible exposure on the job site, and this all goes back 14 days. In no event do we ever let anybody know the name of the employee, even if they consent. You also, if you're working in a building, have to notify the landlord that there's been an occurrence of a positive test in your workplace. The Virginia Department of Health within 24 hours of discovery. And yes, they are going to ask you in Fairfax County, if you're located in Fairfax County, they will ask you for the name of the person and contact information for the infected person, suspected to be infected person, or anybody that was exposed to them, because they are doing contact tracing and you must disclose that information. And then if you have the unfortunate circumstance, we have 3 or more employees on a work site that test positive within a 14-day period, you have to notify VOSH. All right. You have to provide employees with access to their own COVID-19 disease and exposure records if you're required to do that in your industry. I find this to be an odd request, because theoretically the employee should have their own positive test with them, but just know that if your employee asks for that, you have to provide them with what records you have. You have to adopt flexible sick leave policies that are consistent with public guidelines. One suggestion is you could allow your employees to use vacation leave for COVID-19. Most employers probably allow employees to use their sick leave if their vacation leave for an illness, and that would be a good thing to do there. And you have to notify subcontractors and other companies that if their employees have tested positive, they have to stay home and not report back to work until cleared. So those are the mandatory requirements. It's going to be a little bit repetitive because the slide builds off of these mandatory requirements. Now, the regulations do say that employers that comply with CDC recommendations to mitigate COVID-19 hazards and job tests are deemed to be in compliance with ETS if CDC standards are greater or equal to the ETS. So far, they seem to be, with one exception. The CDC permits essential workers to come into the office if they are positive for COVID-19, if certain safety precautions are taken. The ETS standard does not permit that. So if you're following that CDC guideline that says you can have this positive person come into work, you would need not to observe that anymore. And you have to actually be complying with it. So just posting the poster, we observe 6 feet apart, isn't sufficient. But even if you're following the CDC guideline that is not as stringent as the ETS, the VOSH will take your compliance with C as an evidence of a good faith effort to comply, even if the standards aren't greater or equal to that in the ETS. So, good news. If you've been following CDC guidelines in your business, you're probably actually in very good shape right now. This will be something that's helpful for you when you get the PowerPoint. But this first document is actually a template for establishing the program. They have 9 steps to compliance in order to comply. It's called 9 steps for compliance. And if you literally follow that thing and write down what you're saying, you will actually be in a good progress to making your plan. There are additional resources found at this link here. This is where you can print out those publications. And they also have a local consultant involved. I'm always a little bit nervous about telling people, oh yeah, go ahead and call VOSH. They want to come out and do an audit on your workforce. It makes me a little bit nervous. It probably makes you nervous too. But if you're really struggling, they do have consultants available to help you get your plan into place. So the elements of the program are workplace safety, education, training, and prevention, screening, sick, exposed employees stay home, hygiene. These are the main components. So the elements of the program are identifying your risks, developing an infection prevention and control plan, how do I isolate infected people, communicating and training employees on what you're expected, workplace controls we'll get into a little bit. That actually even includes your truck, your shovels, things you can do there, and an analysis of what PPE you're required to have. Again, this 9 steps to compliance, www.doli.virginia.gov/WP content/uploads, blah, 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 blah. That's the guide that I'm referencing here from which you can use to start building your plan. And of course, I have a template that you can start with. So the step 1, this is the first thing you have to do, which you may not have done under the CDC guidelines, although OSHA has already required employers to do this assessment. So again, if you were ahead and complying with what OSHA said, the Virginia standards are no different. So we have the very high risk. We'll go through that. That's not anybody on this phone call. High risk. Again, that's not anybody on this phone call. Medium risk, I think that's the people on this phone call. Lower risk would be people that are in your, if you have an office or you can develop physical barriers. So I think we're in the medium to lower risk step. How do we look at this? Well, we look at it by, job task. Are we an indoor or an outdoor work environment? Obviously, an indoor work environment, we're more likely to be exposed to droplets. We don't have as much air circulation. We have to be closer to each other, which may not necessarily be the same if you're working on a construction site. Also, are you a grocery store owner, right? Are you in a medical office? Are you in a nursing home, known presence of COVID-19? Again, that doesn't apply to us. Here, number of employees in relation to the size of the work area. Is everybody crammed together? That's where I think that we can have issues in a construction area, unless everybody's just in their own individual piece of equipment. But if you have a whole bunch of employees that have to work together in a small space, that's going to increase that's going to put you more towards medium. Again, working distance between employees and the duration and frequency of contact inside 6 feet of a worker. So, are my workers closer to each other within 6 feet, 4 hours of the day, 5 hours of the day, 8 hours a day? Are they working more than 8 hours a day? Find that a convenient number, but that is something cited in the regulations. Are they required to work more than 8 hours a day in a close environment less than 6 feet? So here's how we rate them. What's the likelihood of airborne transmission? What's the likelihood of contact with contaminated surface or objects? Shared tools, shared work vehicles, shared transportation. Are employees coming to your yard and riding in the same truck together to work that you provided as a courtesy? Well, that could put you at a higher risk. Exposure to others. How many other people are working with your employees over which you have no control? I don't know what ABC company is doing. I don't know if they have the same regulations and training that I have in place. You luckily probably don't have as much general public to contend with, but that's what we're looking for here. So very high risk. That is not this, again, no one's conducting intubations, right? We're not intubating any workers there, at least I hope not. We're not doing dissections, postmortems, or laboratory procedures or specimens from a known or suspected source of COVID-19. So we don't have to worry about that. High risk. These are hospital workers, first responders, medical transport providers, morticians, medical and dental staff, non-medical support staff, long-term care. And these are people that are working with folks that are known or suspected to be sources of COVID-19. Again, not us. Here's where I think most people are on this call. You can see example right here in the standards, construction workers. So they require more than minimal occupational contact. They're going to be working together closer than 6 feet. They may be working with people that they don't know are infected or could be infected if it's widespread and you have a bunch of people working a bunch of different jobs. And again, here we have construction workers, laborers, domestic workers, hairdressers, okay? So the VOSH has classified construction workers as medium risk. If you think that you have a specific setting where we can get you into lower risk, we can talk about that, but I think you start that you're at medium risk. And here's a bunch of other examples, indoor and outdoor construction settings. So again, Bosch is telling us that they think that construction is medium. Lower risk jobs. These are office workers primarily, or places where we can put up barriers where they can't work 6 feet apart or where the environment is very much concerned. I can limit, if I'm in the lower risk job as an employer, I can limit who has contact with my employees. I can say, hey, we're only doing virtual meetings and phone calls. Our office is not open for client meetings. I'm going to say, I'm going to space everybody off. I'm going to stagger work, shifts. This is something that I think probably cannot be implemented in the construction field. Now, you can classify your office workers as lower risk, but if you have more than 11 employees, you still have to do the training that are medium. You still have to do the training, and you still have to have disease response. So again, I think we're medium here. Again, we'll go through this very quickly. I can establish a floor to ceiling barrier. I can do telecommuting, staggered shifts, mandatory physical distancing, and I can say, hey, anytime you walk in the hallway, you have to wear a mask, and I can achieve lower risk. Okay, so let's assume for the purpose of this call that we're classifying everybody as medium risk, and what that means is we have to take more steps to create a safer work environment. So step 2 is how we do the self-assessment and screening protocols. So you have to implement low, high, medium, whatever. You have to implement a system for employee self-assessment and screening for COVID-19 signs and symptoms. I can't spell the word, much less say it. But anyway, you can do this by having your employees do their own pre-screening at home, or you can do symptom screening at the job site. You have to pick one. Don't say, okay, I don't trust that employee, so him I'm going to symptom check when he comes to the office. That's going to get you sued for discrimination. So we're going to pick one that we think we can work with, and we're going to stick with it. So we have to know the list of symptoms. These lists of symptoms from the CDC, last updated in May, has not changed, but something that you want to check every once in a while. Your employees should get a list of these symptoms. They should already have a list of these symptoms. These symptoms should already be displayed in a printout from the CDC website, posted on your trailer, or a break room, anywhere where your employees are. These symptoms should be out there. We want employees to know, understand, and be thinking about this, okay? So fever, chills, cough, shortness of breath, fatigue, muscle aches, body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea or vomiting, diarrhea. Okay, those are the signs that are out there now. Some kids are developing a rash after the fact. It's not yet made the list of CDC symptoms. But again, hopefully everybody's posted that already. Here are your options. You can say to the employees, here's your list of CDC symptoms. Before you come into work, you're going to take your temperature. You're going to check all these symptoms, and you're not going to come in if you have any of these symptoms. I'm actually recommending that employers consider adding travel to a hotspot. So if you had an employee that went out to one of these areas that have been designated a hotspot, Arizona, Florida right now, they want to go on and travel someplace on personal travel, I want to know that. And I may require that employee to stay at home. Virginia has not imposed quarantine requirements yet. In jurisdictions where they do, they actually have to quarantine anyway. That's something, if you think you have employees doing a lot of personal travel, you would consider adding. You then designate this person that employees are going to report to every day and say, hey, I checked it. My temperature's below 100.4. I'm good. I don't have any of these other symptoms. I haven't traveled to, Arizona for the week to do some, to hang out with family, and I'm good. These records are confidential. They should be maintained in a file separate and apart from the personnel file. It doesn't make sense. You're not going to file every day that in the employee's individual personnel file. So you just want to have a folder or a location separate apart from other records where you're maintaining these check-ins. A lot of people are using Excel spreadsheets. I think that there may be some modules out there that you can add to maybe timesheets or whatever, but you've got to create the symptoms in a way to check and verify that it's been done. The other thing you can do is survey on the work site. So you take the temperature on the work site, you run through the symptom details with each employee, you look at them and say, do you look ill? Don't you look ill? You can say, have you traveled anywhere? You can add that question. And again, you maintain these records as confidential because somebody's going to have to log that they checked these employees when they came in and everything was fine. You're going to need a good forehead swipe thermometer. You're not going to want to sit there and put a mouth thermometer in everybody's mouth as they come in. And the employee that's doing it would have to be trained on how to do it. Employees have to wear masks when they're getting it done. The one doing the screening has to get it done. If you're having employees come to the yard or they're all riding together before they come into work, I'm not sure how effective a survey on site is going to be, but you got to pick one or the other. So if somebody has a pre-shift self-screen, you tell employees in your published policy, and I'm sure you're already doing this again because the CDC and OSHA have already said this, don't come into work. Call your supervisor, call this person, whoever is designated to have that call. You call this person, you say, I have symptoms of COVID-19. And the response is, thank you for letting me know. Don't come into the office. Go see a healthcare professional. Let me know what they say. Provide me a doctor's note if you have to be out of the office, or provide me a doctor's note if you're coming back in. If someone comes in to work because you're doing on-site surveillance, or even if they just come into work even though they're sick because they need the money, and that's why we want to make sure we have paid leave available and notify these employees of the availability of paid leave. You immediately provide that person with a face covering if they're not already wearing one. You isolate that employee to a location at least 6 feet away from everybody else. And you tell the employee to leave the site, return home, and seek the advice of a healthcare professional. If that employee has ridden into work with somebody else, you should work with them to get them home. This could mean somebody's driving them home. We probably don't want to put them on public transportation. We do everything we can to make sure that whoever's driving them home doesn't get exposed. But again, we got to get them off our work site and at home. What can you ask? You can ask only about symptoms that relate to COVID-19. So our CDC list of symptoms. They're saying, hey, I feel these symptoms. Okay, what symptom are you feeling? If you think that the employee is just, trying to get some free time off from work. All employees have this paid sick leave that's available to them. It's only 14 days, it's only available one time. And you need to counsel your employees that this is leave you need to save for when you need it. So don't be stupid. Don't go to the barbecue or the party with 100 of your best friends without wearing masks. It's your job to, stay safe and keep everybody else safe. We can't dictate what employees do, but we certainly can counsel them that, being stupid is going to put you at economic risk and our whole workforce at risk. We just went through this. Okay. Reducing or eliminating risk of potential exposure to employees. So the main thing we want to do here, and that's the first thing on the list, you need to encourage your employees to report symptoms. And we do that by saying, hey, we've got this leave available for you. We've got the FFCRA leave, hey, we've got sick leave. If you don't take care of yourself now, you could be out longer, you could infect everybody. So that's what Bosch is recommending, that the Department of Labor and Industry is recommending you do as part of this to encourage it. So look at your policies and see if, you can use vacation leave if it's offered. You can make available alternate work schedules, telework. If the employee can telework, that's probably not going to happen much. Staggered shifts, we can reduce risk by saying, okay, if I put a crew of 6 employees all working together in a small space, can I do staggered shifts and have 3 employees working there? I don't know whether that's possible or not. That's something that's recommended. And then we have this other administrative work control practices when you can't eliminate contact within 6 feet. We'll go over that. So procedures to minimize risk from employees or other part of this is training. Hey, we're not going to handshake. Don't goof around. Don't be getting close to each other. If you are allowing employees to come to the yard together, consider eliminating that practice of driving people from the yard to the work site. I know sometimes that can be tough, but if you can do it, that might be a way of enforcing physical distancing. If you have employees that are congregating together on a break and they're closer than 6 feet, you got to train your supervisor to go over there and say, hey, separate, especially if they're taking a break to drink water, right? Usually you can see them, they're going to go up to the back of the truck, they're going to take a drink of water, and they're going to stand real close to each other and drink the water and talk. We can't do that anymore. Get your water, move back and drink it. Where are you going to set up the hand sanitation, disinfecting, and hand washing? Hand sanitizers have to be near any place, but can you keep some? You should probably keep some with them. Sharing tools, they have to wipe down the tools with a disinfecting wipe or spray, and they have to probably wash their hands afterwards. Or if they're wearing gloves, if they're already wearing work gloves, and that reduces the transmission. And require PPE when the above procedures don't provide sufficient protection. What that means is I can't engineer it so that you can be 6 feet apart. So everybody's going to wear masks, everybody's going to wear gloves, and everybody's going to clean off their shared tools before they go and give them to somebody else. Physical barriers, remote meetings, face coverings, issue PPE as required, and then train in the use. The CDC just said, and I know I'm seeing a lot of these lately, and I'm starting to talk to my employees, the face masks that have the valves, not compliant for COVID-19, because the purpose of the mask is not primarily to keep you safe. The purpose of the mask is primarily to keep everybody else safe from your germs. And if you have a mask with a valve, we're not doing anything. So I will be revising the plan that I've been drafting to indicate that face masks with valves are not permitted. I don't care how many filters they have in there. No, there's an exception. If your employees have to wear respirators, then obviously they have to wear a respirator. But for the average guy that's just wearing a face mask and not a respirator, don't be buying face masks that have valves. Okay, that's not doing what we want it to do. If employees are working together and they're having lunch together, then they got to separate there. You're going to post all these signs. You got to post physical distancing. If employees have gone and touched the the water dispenser that you have on the truck, somebody after that, they should be cleaning and wiping that after they use it. So it's ready for the next one. You can also clean things on a regular interval. So somebody's assigned to go off and clean things every once in a while. And you have to have hand washing facilities where feasible. Not going to happen on a construction site, so we have to set up hand sanitizers. How do we make sure people are observing physical discipline? Verbal announcements. Hey, let's all remember at the morning meeting, we're gonna physical distance today. If people are congregating when they don't have to congregate, we're gonna separate them. We're gonna decrease work density where we can, and we're gonna observe any executive orders on occupancy limits. Physical distancing here, again, these people can't physical distance because they need to hear what this guy's saying. So respiratory protection as required by the industry, PPE equipment, all is standard for your industry. Again, what I said about, not having valves on your face masks, if your employees have to use respirators, it's a completely different scenario. They will use what's appropriate for them to use. But note, if you've got somebody that has to use a respirator, don't put somebody next to them that isn't wearing a respirator. So, let's be smart to try to limit our risk. Vehicles. So, unfortunately, I couldn't find a construction truck picture of a whole bunch of people in the construction truck all riding together. The closest I could have was this rideshare thing. But, mass ventilation gloves. All right. So everybody in the truck's going to wear a mask. We're going to roll down the windows if we can. We're certainly not going to recirculate the air. We're going to bring in fresh air, and employees can wear gloves. And you got to develop a system for who's cleaning that truck after everyone leaves. I think it should be the driver, but after everyone leaves, that driver should be wiping down everything. Door handles, seats, dashboard, steering wheel, glove box, anything that employee touched, we're wiping down. So you're required to verify in writing that a COVID-19 hazard assessment has been performed to determine the need for PPE. I have a certification in the template that I've done because you also have to have a certification that you've done the risk hazard assessment, and that's got to be in writing that you've done this PPE. And you have to have an employee representative that participated in designing this PPE. So, you just have to have, when it's done, you have a draft. If you're a union shop, that's easy. If you're not a union shop, pick somebody that can review it with you and determine that they think that that's adequate. It identifies the workplace evaluated, the dates of assessment, and it's signed by the person performing the hazard assessment. And then when you issue that PPE, you got to make sure that it properly fits each employee. So what do you do if that employee refuses to wear the PPE? I'm only going to let an employee that should be wearing a face mask not wear a face mask if they have a doctor's note. I don't want them saying my doctor says it's bad, or I watched QAnon and it says that, face masks are a great conspiracy. I don't want to hear any of that. A religious waiver, I can't think of a single religion that says a mask isn't okay. Most religions have a lot of more people covering up than not. That's in the regulations. I don't see that happening. So again, I only want to be not letting somebody not wear a mask if it's medically necessary, or they really can explain to me why it's a religious waiver. And again, don't let your employees do what this guy's doing. That is not wearing a mask. Okay, that's like not wearing pants. So if you've got somebody up there and they're consistently, I got my mask on and it's on their chin or on their nose, you got to say, put the mask on right or go home. You have to require hand washing. That's just something that's part of your training. Mobile crews shall be provided with hand sanitizer where feasible for duration of work site, work day, and immediately available to nearby toilet facilities. And it has to comply with laws and regulations and standards dealing with sanitation. Again, let's make sure they're being smart about saving it, where they're storing it, making sure it's not next to something that can catch fire. You know, hand sanitizers are flammable. We got to train on the use of it. You have to comply with communications applicable to the employer, its industry for cleaning and disinfecting materials and hand sanitizers. Make sure any cleaning supply that you have out there has the label, instructions, and warning. Make sure that you're keeping a copy of the instructions and labels in a central location on the job site and in your central corporate offices and as otherwise required by Bosch. Okay, if you know the cleaning supplies, I'm not as worried about having, it's not the same as an acid because you should be using just a regular cleaner. The cleaners have to be certified by the EPA as being able to take care of its SARS-CoV-2, that's basically COVID-19. Go to this link right here, list N, disinfectants use against SARS-CoV-2-COVID-19, okay? Also, there have been a lot of recalls on hand sanitizers, so before you go out and buy a truckload of hand sanitizers, do go to the FDA website to determine whether those hand sanitizers are still safe to use, because there have been about 100 of them recalled. So, and check whether what you're using is safe and effective. Because again, there are people just out there manufacturing stuff. So list N, disinfectants for use against SARS-CoV-2, CoV-2-COVID-19. Okay. It's your responsibility as the employer to have this stuff available. And you have to ensure compliance with labels and instructions. You know, hey, look, let's not have people out there mixing up bleach and putting in, used wipes. Let's use commercially available prepared so that we're not mixing and doing things on site. Let's use a consumer rated product. They tend to be, less harmful. Just be smart about what we're getting. Have a mechanism in place where somebody at the beginning of every shift checks to make sure that supplies are available. At the end of the day, somebody's calling into the office saying, hey, we need more of this or that. Is it going out on the truck every day? So think about how we're going to get this cleaning stuff. You have to sanitize things, equipment, vehicles, etc., by an employee's interaction with the general public. Okay, nobody's coming up on the side of the road and getting in your vehicles, so not a big deal. But contractors, other persons, that's other contractors' employees, other employees, and they have to clean the surface immediately after contact with these individuals with supplies to clean, in fact, again, that are on that EPA list. They should be washing their hands if they've had exposure with employees. Everything's got to be this SARS-CoV-2 compliant. And you have to have, your communication standards for how to use these. Common areas. I'm not sure we're going to go into a porta potty and wipe it down. I'm sure if I recommended that to you, you guys you're probably all laughing and falling off your chairs right now, but theoretically that should be done, but just make sure you got hand sanitation after that. Make sure that employees are, cleaning any shared tools equipment prior to transfer from one employee to another. I don't know how that works in the field. We're all digging a shovel. Hey, I want to do it. You're doing it wrong. Are they really going to stop and wipe off that shovel? Probably not. Maybe we can issue work gloves, because I don't think that plastic gloves are appropriate, but that's what the guidelines require you to do. So anything you can do to make it so that we're not having to clean every 5 minutes is probably better. And I don't know how equipment is transferred, but you got to know if one person's getting off of a piece of equipment and another one's getting on, they're supposed to wipe that down before they get off, so the next person comes on and it's clean. That's the regulation. So if somebody's been suspected to be infected with COVID-19 or known, okay, this is the case where your employee calls you up and says, I got symptoms. So we're suspecting them to be infected, or the employee calls and says, hey, I tested positive. You've got to clean and disinfect the area before you allow other employees to access it. What can that mean? If I have a truck that employee was in. They say you're supposed to allow at least 24 hours prior to cleaning and disinfecting. I don't know if that's possible, but that's a requirement. Or you can leave the area unoccupied for 7 or more days. It's probably not going to happen, but you're going to need more in that instance than just somebody that, you know, is wiping it down with a hand wipe. You're going to have to contract with a company to come in and do that electrostatic cleaning, because a deep clean is required after that exposure. And so it's going to be anywhere where they were exposed. I mean, I got to think that's primarily your vehicles and your equipment, possibly a trailer. And you should do a clean. Somebody should be wiping off every piece of every tool that employee might have used. Step 5, keeping known or suspected infected employees from coming to work. We talked about this already, but this is the procedure you're going to use to tell employees not to come in. And the key thing here is the implementation of a return to work plan and procedures. That's the key. So there are 2 ways you can do this. And again, I'm going to tell you to pick one. All right, you're going to pick one and you're going to ride with that. So for the employee that had symptoms, okay, they have to come in. They can't return between 3 days since the recovery with no fever or respiratory symptoms, and at least 10 days have passed since the symptoms first appeared. Okay, so it's 3 days, no fever, and 10 days passed since the symptom first appeared. Or you can do a time-based strategy for the asymptomatic employee. It's different because they don't have symptoms, okay? So this is a time-based strategy. And the employee can't return to work until at least 10 days has passed since their first positive test, assuming no symptoms. And if symptoms develop, then they have to use the symptom test or the test-based strategy. So these 2, what I'm showing you, are non-test-based remedies. So the first one is employee has symptoms or has tested positive and has symptoms, or the employee has tested positive but is asymptomatic, okay? If you have an employee that's been exposed and has no symptoms but doesn't have a test, you are also going to use the time-based strategy. But you are going to follow the employee's doctor's note, right? Because you should be saying to every employee that says, I've been exposed to COVID-19, I have symptoms of COVID-19, or I went and I did a drive-up test and I've tested positive for COVID-19, you are going to say to them, go see a healthcare professional, I need a doctor's note, okay? So in any event, we're following that doctor's note. So there's a testing strategy you can use. Again, if they had symptoms, they have to have a resolution of no medicine. They have to have improved respiratory symptoms. And then they have to have 2 negative tests. It's on there. The FDA emergency use authorized molecular assay for detection of COVID-19 from at least 2 consecutive respiratory symptoms, specimens collected 24 hours apart. So it's 2 negative tests. Why don't I recommend tests? I don't recommend tests because they aren't readily available. What happens if you've sent your employee to a doctor that says, oh, I'm not going to prescribe a test for you, and they can't get to the drive-through test within 24 hours apart, 2 negative tests because the line's really long, and then they're out of work for longer. I just think that until testing becomes more widespread, or, if you're big enough, you can actually contract with a private lab to do testing. But I know that Radford University, where my daughter is, just contracted with a private lab to do 1,700 tests at a cost of $170,000. I don't think anybody has $170,000 to contract with a lab. So I'm not recommending the test-based strategy. Now, if you found a place where your employees have been able to get drive-up tests, and it's not the what do they call it, the ready test or whatever that happens really quickly. These have to be nasal swabs. If you found that location and you want to do testing and you haven't had any problem, then implement the testing strategy. But think about that. If the employee refuses a test, you can rely upon the symptom strategy, but the employer can require the test under ETS guidelines and the employer has to pay. because under the EEOC and the EEOC regulations of the Americans with Disabilities Act, you can't require a medical test. This is obviously a medical test unless you pay for it. I say no matter whether it's time-based strategy with a symptom-based strategy or a test strategy, require the doctor's note. I've said that even before this regulation, but even more so now. The ETS regulation repeats in every section related to asymptomatic, positive, known or suspected symptoms that the best strategy is to implement a policy that involves consultation with appropriate healthcare professionals when employee has satisfied the time-based strategy. You can, again, with the testing, you have those 2 negative tests, so it's not needed, but they have to provide you the test results. Lately, I've had tussles with employees that don't want to provide the positive test result. They just want to have time off from work, or they don't want to come in, or what have you. They're required to give you both the positive test and the negative test. But if you're doing the time-based strategy or the symptom-based strategy, relying on that doctor's note satisfies that requirement. So again, when your employee comes in and says, I've tested positive, great, I'm doing the doctor's note, return to work, time-based strategy for return, have a doctor's note. And that protects you. So the notification procedures, go back to slide 9. We've got to notify these employees who may have been exposed directly to that employee. So if you have 6 people working on the crew, you're going to notify them that one of them was exposed. And you got to notify that if one of them tested positive or has symptoms. You don't tell them who, they'll figure it out. Who cares? We don't care. You just don't tell them who. And you tell those employees to go consult a healthcare provider, leave the work site, and come back when they have a return to work note. The healthcare provider will decide whether or not that employee has been exposed enough to merit quarantine, or whether they've been exposed enough and they want to have the employee, they say, get a test. So even if you don't have a test-based strategy, an employee can still get a test, but you can't allow them to return to work with a test unless they have those 2 negative tests within a 24-hour period. Once you notify those other employees, and this is all the first 2 are within 24 hours, you have to notify other employees that there was an exposure on the job site. So anybody that was working that day says, hey, we had somebody test positive, unless I've notified you specifically that you need to do something, you weren't exposed. And then you have to notify any subcontractors whose employees may have been exposed to them, and you have to do that within 24 hours. And notify them if employees were directly exposed or at risk, or it's just job site wide. Have to notify the Virginia Department of Health when you have a positive test, not symptoms, but when you have a positive test result. You have to notify the Department of Labor and Industry if 3 or more employees present at a work site within the 14-day period test positive. You have to notify the building facility owner of occurrence of a positive test. I assume that also means the work site. So if you've got a whole bunch of other contracts and it's a VDOT work site or it's a private site owned, I think you have to notify the landowner. Although outside it doesn't really matter as much. So this is what I tell you to tell employers and employees contracted COVID-19. You're going to clean everything that they touched. All personnel that were in close contact with the employee have been notified, and that's it. Even if they press you for more, you cannot disclose that information. And please don't ask me if it's okay if you ask the employee if it's okay to disclose the name. That's going to be interpreted as you putting pressure on the employee to disclose their name. So don't ask, don't tell. You must have an anti-discrimination or retaliation policy. And I've included that in the template, but it has whistleblower protections. It gives the employee the right to say, hey, this is unsafe. I complained about it. You haven't fixed it. I'm not going to come into work until you do. And if it's reasonable, you can't fire them for not coming back to work. If you have 11 or more employees classified as medium risk, we have to do this disaster preparedness response plan and a training plan. We've got 60 days for the disaster preparedness response plan, 30 days for training. okay, again, I think, you're going to train employees. This is how we wear a mask. We want you to wear gloves. Make sure don't go congregate. Whatever training you're going to do for the employee on what standards you've established, you have to train them on it. You can do a PowerPoint. You can do a training in the field. However, you can, provide it in writing. You should probably translate it into Spanish. And you have to post that COVID-19 workplace free that Bosch has provided. And you can find that on the Bosch's website at the doli.virginia.gov. Okay, I ran through that really fast, but it still was almost an hour. So I can take questions at this point.
Thank you, Susan. Ashley's got a couple of questions that have come up through the chat box, so I'm going to let her run through those first and take verbal questions.
All right.
The first question is for the 3 or more at a job site. Is that per job site location or 3 within the organization? And maybe Kimberly
it's the job site. So if you've got different job sites, it's at the specific job site, because what they want to do is see if there's something going on at a particular work site.
Excellent. I think that answers that question. The next question was, do you have to log the temperature or just check off to confirm that it's done?
I would log the temperature to show that somebody actually took the temperature, and then it's a way for you to check, because if everybody is 98.7, then somebody didn't do a temperature check. So I would log the temperature.
So a daily log is your recommendation there?
Yes.
Mm-hmm. Okay. The next question is, are we required to pay the employee who came in sick who possibly exposed everyone else? Are you required to pay for that day?
If they're working in DC, yes, because you got to pay them at least 4 hours, I think. It really depends upon the job site. Otherwise, you can just pay them for the hour that they were there, because we have to comply with all wage and hour laws.
And somebody asked us a question too. When you're paying someone for 14 days of leave, would a company be required to pay that twice if a person comes down with COVID twice?
No, it's one time. That's why it's so important to tell these employees it's one time. Well, it's not one time. It's 14 days total. That's it. That's all you get.
Okay.
So they want to be careful in using it.
Great. Thank you for that. The next question is, based on guidelines I've seen, if they were exposed to known COVID-19, it is still 14 days, not 10 days, which is correct. Is it 14 days they need to sit out, or 10 days? It goes on to say, if an employee who was sick with symptoms goes to the doctor and receives a note that it is not a COVID-19 concern, however, not diagnosed with something else, do they still need to follow the time-based strategy?
No, if you have that doctor's note and the doctor's note appears to be reliable, then the regulations actually say reliance upon a doctor's note is deemed to be reasonable compliance. Now, if the doctor's note looks like a drive-by and it's shady, then depending on the circumstances, we may have to dig a little bit more, but reliance on a doctor's note is all that's needed under the regulations. You're going to have problems. People have asthma. They have a dry cough. How do I know if I got to rely upon what that doctor's telling me?
Okay. And the next question, which I think is a great question too, is what if an employee says they're not comfortable coming back to work or to a specific place of like a specific job site? You offer them a different work location with additional protections and they still refuse. Can you mandate they report to one of the sites provided as alternatives?
Okay, so here you're getting into possibly an ADA accommodation, Americans with Disabilities Act accommodation. And typically you have these employees that are requesting it, and I assume that's the case. Maybe you could type to the questioner and ask them. I assume it's a case where you have an employee that has underlying health conditions that that make them more susceptible to COVID-19. So diabetes, heart condition, asthma, all these underlying health conditions that are also disabilities under the Americans with Disabilities Act. Once they say, it's not a COVID-19 issue, and it looks like it's a disability under the Americans with Disabilities Act, I then have to engage in an accommodation discussion with them. If we provide reasonable accommodations, which you've indicated, I'm taking you off of the work site where you're working with 6 people, and I'm putting you on a work site where you're working with 3. I've done the best that I can. It's an essential job function that you come to work. Take these accommodations, or here's 2 weeks paid sick leave, because with a doctor's note that says that they're doing it under qualifying reason number 2 of the FFCRA, which is a doctor's note has been provided that says, due to this underlying medical condition, the employee is at risk of complications of COVID-19. I've provided you with this accommodation. Come back to work with these accommodations. 2 weeks for you to figure out whether you want to come in or not. And if they don't come back at the end of 2 weeks, you've done everything you have to do under the law. You've provided them with the 2 weeks of paid sick leave. You've offered them reasonable accommodations that they don't come back in. You can terminate work employment. You can terminate employment. I'm going to add one other caveat. If you are over 50 employees and you are covered by the Family Medical Leave Act, you can offer that employee to fill out an FMLA certification by their doctor, grant them FMLA leave for a serious health condition, if they can make it that it's a serious health condition. I'm not sure that they will, but you follow that procedure. You can provide them with 12 weeks of unpaid leave, go home, and at the end of 12 weeks, you want to come back to work. COVID's not going to be over, but here it is. So I think you want to offer them every accommodation that you have to, but at the end of the day, having satisfied a reasonable accommodation discussion with them, you cannot do a construction job remotely. You do not have to create another job. So at some point, if you've done everything you possibly can, you just have to have that discussion with the employee and say, hey, COVID-19 is not going anywhere. This is the best I can do. What do you suggest I do? And if they say nothing, I want to stay at home with pay, well then, that's not an accommodation.
Good to know. Thank you. The next question is, if an employee was potentially exposed to someone who tested positive, whether that be on or off the job site, but they have no symptoms, does that require notification to other employees that they may have to come in contact with them?
So in that scenario, what we're going to do, we have an employee who's known or suspected to be, they've been exposed to COVID-19, which means they can possibly be infected. What we're going to do is we're going to send that employee to visit their healthcare professional to provide us with a note about whether or not the doctor thinks that the exposure was of sufficient level that they should quarantine. If the doctor says that exposure is a significant level for quarantine, then you have to notify the other employees that there was an employee that they worked closely next to who may have been exposed. You can then send that notice out as required. You're not notifying the Department of Health, but you can say there was a potential exposure and notify other people. I still think you have to notify those in close contact, but probably contractors that they were working close to, and a global announcement, but we don't notify the Department of Health. You can offer employees the option of getting a test if they want, the 2 negative tests, but that's up to them. And you're relying upon this, whatever the strategy is in the doctor's note.
Thank you, Susan. The next question is, do our companies need to provide the names of positive personnel to the county or to greater regions?
Yep, to the Virginia Department of Health or Fairfax County or whatever county it is. Yes, the regulations require that you provide information you notify the Department of Health or the local Department of Health. They are going to ask for contact information. You are required to provide that information. The whole purpose of it is contact tracing.
Mm-hmm. Okay, so there's local there's a local line or a local resource for each county or
Yep.
district to do that.
And they, Loudoun County's not doing contact tracing. So if Loudoun County Department of Health isn't, you can contact the state, you can contact the Virginia Department of Health. Is what the regulations specifically say, but I think you also get that done by contacting the Fairfax County or whatever the county organization is and report it up the chain.
Great, okay. The next question is, does the employee need to use their PTO first before the 14-day paid COVID by the employer applies if the employee is COVID positive, has symptoms, and or is waiting on test results?
That's up to the employee. The employer cannot require the employee to use their PTO first, but if the employee wants to use their PTO first, they can. But that's not an employer decision, that is an employee decision. And you have to say, hey, we've got this leave.
Okay.
I recommend that my employers just use the paid sick leave if they're in those categories first. And I said to the employee, okay, we're going to give you these paid sick leave benefits, and then let the employee say, no, I want to use my PTO. Again, I'm not sure if I covered it, but or people have read it, you've got to keep your documentation of the leave that you've granted. So that would be a doctor's note and to document that leave. Because you get a tax deduction for it.
Okay, good to know. And then it looks like the last question is reporting the 3 positive cases to the VD, where did it go? To Virginia Dolly in the 14-day period is even if the employees became positive from family members, not from work, and did not return to work while positive, correct? Not just 3 work-related positive cases.
So they're asking, here's the scenario. I had 3 stupid workers that went to 3 stupid family parties and all happened to get COVID-19 at the same time. The law, the science is not that specific about where employees catch it. So it doesn't matter. We're not, as the employer, going to say that was where they got it was there. So yeah, if it's 3 at that job site within a 14-day period, you got to report it. We aren't the contact tracing people here.
Okay, I think Vincent just submitted a question, but I believe that answered that as well. Does the 14-day paid COVID leave apply to new hires as well?
Yes, that leave is available immediately upon hire. The only 30-day requirement in the FFCRA is for Family Medical Leave Act leave, expanded for childcare. Everything else is available that day. You're hired.
That was a great question. And aside from this PowerPoint that will be, of course, provided to our membership and listed on our website, are there other training resources for our members in the field that you recommend?
So all the links are there. I do have, if I'm still sharing my screen, I do have this template that I'm working on that I can provide you guys after I clean it up a little bit more. But you can see it's quite long. It's 25 pages. It's built kind of to check in the box. It guides you through what you have to do to determine, this attached as an appendix here is a list of the factors for determining the classification. The employer then checks the box of where they think they are. And then we check what all you have into place. And then there's a certification saying that you've done all these things. So the purpose of this template is to kind of have employers work through and think about what they have to do, but also develop a plan at the same time. So I will provide that to you within the next couple days or so. And then I'm happy to work with employers to, customize this or answer any questions that they may have. I do not have the disaster preparedness template response yet or the training done. And we're coming up on the training, but we're already behind on the plan. So I'm doing the best that I can.
Awesome, thank you. And then we do have another question. The FFCRA only applies to employers of 500 people or less. Is that correct?
Correct. less than 500, so it's 499 employees.
Okay.
And that was because the really large employers were able to persuade Congress that they do such a really nice things for their employees already that they don't have to have this mandated leave. I think you should ask the employees how they feel about that.
Right. Okay. Do we have any other questions from the crowd? It's great that everybody's been tuning in and asking their questions. Hopefully everyone feels like their questions have been answered as well.
Well, Susan, first, thank you for this presentation. And I will tell you, you've now set the record. This is a crowd that never asks questions. But obviously you're striking a lot of chords here. So thank you very much for that and engaging. And I'm sure you'll hear more.